Well, welcome everybody to our SCCPDS collaboration with the AAST and AAST for the Career Catalyst webinar series. And this year's theme has been building your brand. And so our theme today is going to be defining your internal compass. And so I would like to introduce to you our panelists today. So I'm one of your moderators, along with Krista Kaups. We'll be keeping everything in line and making sure that all of the questions from the chat get answered. So I'm the Chief of Acute Care Surgery here at UC San Diego, and I'm also on the Communications Committee for SCCPDS. Krista Kaups is at UCSF Fresno and is the immediate past president for SCCPDS. And so for our panelists, we also have Dr. Charles Adams. He is our current president for SCCPDS, our fearless leader. And then our other panelist today will be Dr. Alex Schwed. He is a trauma surgeon, program director for general surgery residency at UCLA Harbor. And then we have Najiha Farooji, who is a trauma surgeon extraordinaire, just finished her very first year as faculty. So she is just getting going in her career at Staten Island. So we're really looking forward to a great discussion today. So please, we encourage you as we go along, if you have questions that come to mind, throw them into the chat. We will make sure that they get answered by our panelists. So without further ado, we'll go ahead and get started.
All right. Every Zoom presentation begins with the same question. Can you see my slides?
Yes.
Thank you. So thank you, Dr. Haynes. This is really, this is an honor, and it's also a lot of fun. This is not a talk that I've given in a formal setting, but the topic is something near and dear to my heart and something that I've talked to my people I've mentored over the years, medical students, residents, fellows, even junior faculty. And it's something that we don't really talk about that much. And I think it's really important. So I'm really honored to have this opportunity to sort of share my thoughts. I have no conflicts of interest. I'm pure as a driven snow. This is a short talk on, we're short on data here, but we're very long on opinion. And I would say that I may seem like I have all the answers, but this is really a work in progress. And a little bit later, I'll touch upon some of the changes that you will probably undertake in your journey as you define your internal compass. So internal compass, I'm going to abbreviate as I see, nice graphic here that kind of sets it. But really, we need to define it. Like, what is an internal compass? I think most of us kind of have an understanding of what it is, but in simplest terms, it's your own internal guidance system. And that sounds, like inertial navigation, your own internal GPS, whatever you want to say. But really, it's a collection that's comprised of your beliefs, your instincts, your desires, and most importantly, your core values. And it reflects a little bit of your culture, your heritage, your childhood, your environment. But really, this is something that you define for yourself as you mature as an individual and you sort of morph into adulthood. I think most of us go through this, and I'll touch upon it a little bit about how most of us have already done this, but probably may not be totally aware of our own compass. Why is this important? Well, really, it enables you to individually define what you find right and wrong, what you find appropriate or inappropriate, acceptable or unacceptable. And hopefully you use this to guide your decision making. And I would argue that it's integral to giving you a purpose-driven life. And I think it's at play, even if you're unaware of it. I think deep down, you have an internal compass that is guiding you that you may not have recognized. So we'll touch on that as well. So it's truly an iterative process, right? And most of you will say, well, I'm not so sure that I've done this, but you have. Each one of us probably went through this when we did our first medical school personal statement. if you look back, and hopefully you saved it, because I always encourage people I'm mentoring to sometimes go back and to revisit your decision making. Why did you want to become a doctor? I think it can be a very, very powerful tool to reflect upon where you came from and where you are now. You did it again for your residency application and for your lovely SAFIS personal statements. So my inbox will be jammed with all of these. And I actually really liked reading the personal statements. As an aside, one of my associate program directors, we published a paper talking about personal statements for SAFIS. And although penetrating trauma is down in the United States, about 20% of our personal statements talked about doing an ED thoracotomy and sewing up the heart. And we just thought it was kind of amusing. And we talked a little bit about the value of a personal statement. As an aside, I can tell you it's sort of the 15-5-80 rule. 80% of personal statements you read and you're like, okay, that makes sense, 5% of personal statements you read and you're like, this person is truly amazing. This is someone I have to meet. It's so compelling. I remember reading one personal statement from someone who was applying for our critical care fellowship, and he was actually held in captivity by ISIS and was rescued in Iraq by US Special Forces. And I thought that that was possibly made up, so I Googled it, and lo and behold, it was true. And he was just an amazing person to talk to. He's in that 5%. So 80% are great, 5% are amazing. They knock your socks off. They're unbelievable. And then there's the 15% that you read this and you're like, oh, I can't. I just can't. So as an aside, you really want to be in that 80%. Don't shoot for the 5 and just don't wind up in the 15. And you will do this again with your cover letter when you're applying for jobs. And I actually put a lot of stock in those cover letters. I take notes and I refer to it when I meet the person. I have them expound upon some of those ideas because I think it's really important. So how do you define your internal compass? And I think the first thing you have to do is self-reflection. And I talked about going back to your personal statement, but really you have to be honest with yourself and think about who you are, what you like, what you don't like, and what is your motivation for those things. Answer the why reason. A lot of times at the beginning of the year when I was meeting with incoming fellows, I would ask them, what do you want for your career? And along the way, the first couple of years I did that, I didn't really put too much thought into it. But afterwards, I started thinking, why? And I would ask the applicant or the fellow, by this point they're already matched, say, why do you want to be a chair? Why do you want to be a program director? Why do you want to be whatever? And it was remarkable that so many of them couldn't really articulate the why. That why is really your internal compass. So they have their goals down, but they don't have their internal compass. I think most of us, whether it's a personal statement or just talking around, you probably run this by a trusted confidant. If you're fortunate enough to share your life with somebody, you're probably going to reach out to them. Hey, read this. Hey, what do you think about this? Maybe it's a colleague, someone you trained with who knows you really well. Maybe it's a mentor. But someone you trust and value their opinion is going to, and they have to know you well. Sort of look at what you say and say, you know what? Yes, that's you in a nutshell. And if you're not being honest with yourself, they will say, no, not necessarily. What about this? So really, you're going to go back and you're going to reflect on their feedback and really be honest with yourself. And then you have to do it. You put pen to paper. This is your personal statement for your whatever. But most importantly, you've gone through this journey and now you define it for yourself. What do I value? As an aside, early on, I thought I wanted to be president of AAST. I have zero desire to be president of AAST. I mean, if they ask me, sure, it'd be a great honor, but that's not in line with my value system. It's a lovely goal, and I'm always amazed at some of my colleagues that are honored with that, and God bless them. But for me, it's not my value. And I think that's important. I've gone through this a lot. And you have to reevaluate your internal compass. Your values may not necessarily change, but they do maybe change in a rank order. I can tell you, like, after I had kids, my personal values changed dramatically. And I think anytime there's a major life event, um, changing jobs, which I've experienced recently, or birth of a child, death of a spouse, change in whatever, your chair gets fired, any big life defining event that happens, you should really think about where you are, who you are, and where do you want to be. And this may be an opportunity for you to sort of move on. So it's a really powerful tool. I think your internal compass really can authenticate your decisions, your actions. It's really your compass, if you will, that guides you on your journey. And it really will increase your self-awareness. And this is really important because it will define why you do the things you do. And that self-discovery process will help you identify your strengths, your weaknesses, and where will you draw the line? What will you not do no matter how much pressure is exerted on you? And I think once you do that, it's very enlightening and it's also empowering. So I think you should do that. And this is my personal belief, and I'm curious if others really share this. I think once you do this, it increases your resiliency. And resiliency is always said to be the antidote for burnout. There's a lot of talk about burnout, but nobody really talks about how do you increase resiliency. And I think the first thing you have to do is define your internal compass, because once you do that, and if you're true to your own values, you have tremendous self-esteem. You can stay the course no matter how much criticism or external pressure is applied to you. You're like, this is why, this is what I'm going to do. This is why I'm doing it. And I shared that openly with my partners, and I think that built a cohesive team. And I really do think it makes you a better leader. I think it also can help you recognize more personal satisfaction and even professional satisfaction. We'll touch upon what happens when you're disingenuous or you're not following your internal compass, the dark side, if you will. So I can tell you firsthand that doing this self-reflection can be a little unpleasant. It can be traumatic. It may stir up some emotions, some desires, some negative experiences. Some people actually seek out professional help for this. And really, a coach and a therapist are really the same thing. And really, the difference is this. The coach is paid by somebody else. So the deliverables for that encounter is what somebody else sets. Your institution may give you a coach to make you a better leader. They're invested in you, they're investing in you, but they want you to be a better leader because it's more for them. If you hire a therapist, you're paying the bill, the deliverables are to you. The secret is both of them employ the same type of strategy, and a lot of it centers around your values. I would say that the further you stray from your internal compass, the proportionate rise in your stress and anxiety and unfulfillment all increase. And you've heard the term Pyrrhic victory. If you achieve your life goal, but you're not really in line with your internal compass, I think you're going to be hollow. And I think you're going to be disillusioned, and that can lead to bad behavior. Thinking of my own life, I got promoted way too young. I was a division chief of a level 1 in Ivy League before I turned 40. I was not mentally prepared for that, and I did not define my internal compass. And when I reached that pinnacle, my life's goal, if you will, I was disillusioned because I had not done the work that I'm talking about here. So I think it's really powerful. Once I did that, I was a much more effective leader. And I think the other reason why people sometimes hesitate to do this, it's why people don't like public speaking, right? You're vulnerable. Your fear of judgment, fear of rejection, you have nowhere to hide. But like I said earlier, articulating that can really empower you and protect you. If anybody can tell me who this is, I'll Venmo you lunch. I actually thought you were going to know. So this is Richard Payman.
I don't want to spoil it, but yeah.
You know Richard Payman?
I didn't hear what you talk about because I think he's great.
All right, so I owe you lunch, and that was not a plant. So one of his famous quotes, and he was a Nobel laureate on theoretical physics, and he has a lot of famous quotes like most brilliant people. And someone asked him about his secret to success, and he said the first principle is that you can't fool yourself, and the problem is you are the easiest person to fool. And I think what he's talking about is what I just went through, right? You have to sort of be true to yourself. So you can ask yourself, as a human, what's the most important thing? Is it achieving your goals or is it living by your values? And I just put this slide up that I made because really, if you think about it, your goals are your destination, but your internal compass and your values is how you get there, how you navigate there. Goals are finite. They're kind of yes, no, binomial. You either get promoted or you don't. You get a grant or you don't. But your values are unending. They're always with you. Your goals can be really influenced by external forces, whereas your values are yours. And if you're true to them, it's very empowering. You don't seek external validation because you're self-validating from within. And that gives you a lot of power, if you will. Goals are always in the future. You're striving, moving towards something, you're going somewhere. Whereas your values are always with you and they're enduring. Goals can be transient. You know, what I thought when I was younger and junior, like, oh, I want to be president of the AAST someday. No, that was transient. But my values are enduring and they're very powerful. They're so powerful, in fact, that that's the central component of ACT therapy, acceptance commitment therapy. You know, you've heard of the term mindfulness, but it's really about defining your values and then living your life in accordance with your values. It's kind of a simple thing, but people pay, you know, therapists a lot of money to do that. You can do it on your own. So to sort of wrap up, you know, your internal compass is a manifestation of your own internal values. And I think defining it is an iterative process. And I really think you would benefit from using a trusted confidant. And you may actually need a coach or a therapist if you uncover some unpleasantries or something. You know, it can be a little bit traumatic to do this and to find out that, you know what, I wasn't being true to myself. I do think that once you define it and you sort of respect it, I think it really is the antidote to burnout. It inoculates you, if you will, to a lot of negative crap that we all do on a day-to-day basis. And I also think that if you're not true to your internal compass, it can wreak havoc in your life. So the last thing I would say is you need to revisit it after major events in your life and recalibrate. It's not that your values are going to change. Usually they don't, but maybe their importance, their rank order, if you will change. So that's all I got. Hopefully I stimulated some thought and looking forward to the discussion.
Fantastic. Thank you so much. I think there's so much in there that I'm sure many of us can relate to, and I'm looking forward to questions and comments from our audience. I know we have a lot of brand new fellows and young faculty in the list of people who have joined us. As I was scrolling through, there's many names that I recognize, so that's fantastic. My first question to everybody, and you know, as you were talking, I was thinking about a few years back, I did it's called Health Leadership Academy. And the very first day of it, I think was very well planned and in line with what you were saying was we really talked about we had to go through our values. We had to define our values. We had to write them down on paper. And it was probably one of the most challenging exercises that I've ever done. And part of that thought process, and I'm throwing this to our panelists, is what gives you energy and what takes it away? So are there things that you think about, you know, either in healthcare or in life that really makes you enjoy what you're doing, or things that you're like, oh my gosh, I have to go home and take a nap because that was just too much? So Alex, I'll throw that out to you.
Yeah, I mean, I interrupted Dr. Adams. I didn't mean to, but I love the Richard Feynman quote about and I'm going to butcher this slightly, but it's something to the effect of, in order to master something, you have to be able to teach it. And so I actually come from a long line of teachers. My mother was first a third grade and then a first grade teacher for like 30 years before she became an administrator in like the last 15 years of her teaching career. So um, uh, I have a very vivid memory of being an elementary school student, fifth grade, and my mom is the third grade teacher. I joke my dad like is a lawyer, but he always wanted to grow up to be an American history professor. And so the thing that really fills my cup is being a teacher. And just for the people at home, Dr. Adams' laptop has crashed. We didn't kick him out of the webinar. He's coming back. He's safe. Um, uh, so I think, Dr. Haynes, in answer to your question, the thing that really fills my cup is being a teacher and teaching. Dr. Dultz was also supposed to be on this panel. She and I are both program directors, me for residency and her for fellowship. I love that job. There are a lot of things about being a program director that are not awesome all the time, right? Like HR stuff, compliance stuff, complaints, yada, yada, yada. But the thing that fills my cup up is watching the transition from being an MS4 to a PGY1/R1, or looking at, I happen to have 4 chief residents who happen to all be women who are all going into trauma, and looking at them leading their teams and taking care of really critically ill and injured people, and having had just maybe a very, very small part of them learning something. That's what restores me. And I've made peace with the fact that they make fun of me for all my little things that are in their ear, in the same way that I think we all have that little voice from our teachers and mentors in our ear. And that's really what fills my cup. Sorry, long answer to a short question, but I'm very passionate about teaching, and that's what fills me up.
I love it. Thank you. Naji, what?
So I'll echo what Alex said. I'm also the associate program director of the fellowship here at my hospital. For me, it's positives and negatives, right? And having, looking straight and looking at and trying to, envision myself and see what I would here to achieve. I'm here not just as a surgeon or, as an educator, but I'm here to make a difference with whatever skills I have. And, that difference can be in a patient's life. Like I see someone who is intubated and about to die, walking out my ICU, bringing me food as a thank you, as a token of gratitude. Or it could be, a MS4 telling me how great they have become at suturing, or the chief telling me to shut up and let him do the case because he knows what, I mean, in a nice way, but what. So this is what really fills me with a tremendous amount of energy. And then after that, if I cherry on the top, cherry on the cake is when I'm able to navigate through a very difficult case, when I tell the family that I don't know if the patient will be alive, but I come back, tell them, and a hug, and a warm, sincere hug, that tells me that I'm actually making a difference, no matter how junior I am or how insignificant I am in the bigger scheme of things. What really drains my energy is the negativity. And that negativity can be in the form of paperwork, in the form of unnecessary or inadequate emotional intelligence in my colleagues, in my peers, in my medical students, trainees, whatever. That does drain my energy. But there are days when one side is heavier than the other, and then the days that I'm like, I just want to get out of here, and the days that I'm like, oh, I don't want to go home. I'm having such a good time. So that's how I live my life.
So we were just talking, I'm so glad you were able to rejoin us.
Yeah, I finished and I said, I'm looking forward. And then the laptop crashed and like rebooted. So I apologize for my absence.
No worries. So we were just thrown to the panel, you all. What gives you energy and what takes it away? What are those things that you've been able to identify for yourself?
You're asking me?
Mm-hmm.
Yeah, so that's a great question. Again, the whole concept of your internal compass. I mean, I went through this a bunch of times. And for me, it was pretty apparent, right? Patient care is my highest value. Things that touch patient care are the most important to me. Then my second is education, and research is third. So the things that give me power is when, my day-to-day occurrences sort of coincide or align with those values. And what takes away is when I'm forced through whatever reason to sort of stray from that. So if I can't get the resources I need to take care of patients the way I want, that leads to sort of a loss of power, a loss of energy. And, then I go into a funk, like, what am I doing here? And then, conversely, you know, when you achieve something for your program, for your partners, for your system, but most importantly for your patients, you're energized. And it's sort of a self-fulfilling positive feedback loop, because then, the ball starts rolling and then you want to do the next thing and the next thing. So I think, that's kind of how you bang through life as an acute care surgeon, and especially as you rise through the ranks and you come into leadership roles.
Mhm. So along those same lines, how has that kind of influenced a little bit of what you're doing today? Because I know, from a fellowship standpoint, you're kind of, I remember when I was a new fellow, thinking, where am I going? What am I going to do? And being sat down by one of my mentors and being like, are you ever going to do X, Y, or Z? And I of course said no. And of course I've done all the things I said I would never do. we've talked about that, but only because it aligned with my inner values and what I really and truly enjoyed. And so what is it about how, I guess a little bit of an expansion on the last question, but how has that truly impacted your career and what you've done now, and your decision making? Alex, we'll start back with you.
Okay, sure. I feel like in the same way, we were talking before about, I come from a long line of teachers. There's no doctors in my family. And I think it's probably apocryphal, but my mother will tell you that, like, I went up to her and I was like, I want to be a heart surgeon for babies when I was 5. I don't think I said that, but, and I'm not a heart surgeon for babies. That's my version of, terrifying. But I was always interested in medicine. And in the same way, I feel like very early on in residency, I was really interested in medical student education, resident education, and not just doing the teaching, which is wonderful. And I think everybody who is in our discipline is a teacher, right? If not to trainees, then to patients or their families. Like, there's a lot of teaching that happens, but I was really passionate about making things better. How do we change systems to assure that residents are more likely to complete residency? How do we make it so that we are learning what we need to learn and doing what we need to do, and not have it be bogged down either in, this is how we do it because we've always done it that way, or we haven't ever thought critically about a way of doing it better. So, I think, Dr. Adams, you were talking a lot about this idea of sort of returning to, like, internal alignment and, like, thinking about a compass. So for me, in my career, early on, I thought more so than just, I loved your thing about 5, 15, 80 for the personal statement. And for the residency side, I also read a lot of personal statements about ED thoracotomies, although not usually watching, or some, crazy, my least favorite one is like, and then I went to Peru and realized that, like, people are people. And it's like, that's great. And also, people are people in Los Angeles or in Staten Island or, in New Jersey. And so I think the thing for me was early on feeling like, more so than just being a teacher, I wanted to be someone who changed teaching. But a lot of the time I got feedback, or people sort of questioned that or said, hey, that's a great idea. And it's also really hard. And so really thinking about, like, I knew that I was going to have to make sacrifices. So, like, for example, right now, one of the things that's challenging for me is that I love being a surgeon and being clinically active. I can't be as clinically active as I was before I was the program director. There just aren't enough hours in the day. I totally agree with Dr. Farooji. The passionate hug, the letter from a family, those great outcomes really fill my cup, and I hold on to them. But thinking about, like, what my career goals are, I still really want good patient care, but for me, I'm personally okay with doing a little less direct patient care, because I take a lot of pride in thinking about, my residency, my residents, my program, my hospital. How do we get the future of surgery to be as bright as I think it still is, if that makes sense.
Absolutely. Naji, what are your thoughts as you're navigating your early career?
So the internal compass, I just categorized into two things. One was philosophical and like the abstract ideas, and one was like, the achievable goals, like things that were pretty tangible. So I knew that, we all want to make a difference. We all want to do the best that we can. I come from a family of doctors. Like you pick up a stone and there's a doctor, right? But there was only one surgeon. One of my aunts was an OB/GYN, and that's it. So for me, I always wanted to know that I will be going in patient care and I'll be treating, all these patients like my family members, and I'll fix them. But my goals kept on changing with the challenges that I had. So the initial challenge was to kind of convince everyone that I will be on my own as a woman and I can travel and do a residency in a country where I have no relative present. So challenge number one, that was my initial goal. Then the challenge was to find my way in this system without a true mentor. That was done. Challenge number three was to figure out if I want to be a thoracic surgeon or an acute care surgeon or a trauma surgeon, and how to take care of patients, and go in a place where they can fulfill. I feel fulfilled in the end, and they can it can be a symbiotic relationship. That was done. Now at this point in my life, when I have seen a lot in a safety net hospital, in the first year of my attending ship, my compass stays the same, but my goals are changing, and I'm trying to figure out how I can align them without really compromising every glass that I'm trying to hold. And this is more about how can I fix things? How can we make it better on a broader scale? Because it's different when you're in a hospital and treating that patient, but that care has to be standardized. And that's why we have a residency program. We have trauma systems, we have guidelines. So now I guess moving forward, that's going to be my next goal in life, and seeing how, and I'll try to figure out how I can achieve it.
Fantastic. And just a reminder to our audience, please put questions in the Q&A. We're monitoring that. We want to hear from you. We want your questions and thoughts and things that we can do to help provide mentorship and guidance, and even share our failures and our successes. So we're here to really be a resource to you today. Dr. Adams, thoughts on that?
Can you restate the question?
Absolutely. Sorry, I feel like I'm on Jeopardy all of a sudden. No, so so really kind of using your what gives and takes your energy. Those things obviously play into what we do every day, and we have the things that we truly love. But then as we're taking on leadership roles or we're making goals, what things more concrete has that allowed you and to kind of guide you over the last years?
Yeah. So I guess, one of the challenges that happens as you sort of rise through the ranks and take on new roles is that there's a lot of things that you would like to do that you find personally rewarding and valuable and energizing. There's always a paper that you think you want to write. There's always a project you want to do. There's something you want to do, injury prevent, like you name it. But as someone said recently, there's only so many hours in a day. And what happens is there are things that we all have to do. Like, I heard documentation and charting and all that stuff. That's inescapable. And if you don't do it, there's a lot of negative things associated with that. Some of them can be very bad. So you don't have a choice there. You have to do that. And what happens is you wind up cutting muscle. There's things that you want to do that are important to you that you just don't have the time. And that can be, you can go through the stages of grieving as you give up these projects and these ideas and these aspirations. And I can say personally, when your responsibilities and the things you can't give up outweigh the things that give you energy, then you're in trouble. And that might be time to recalibrate and saying, you know what, I've been chief for a long time. Maybe it's overrated. Maybe I can delegate or offload or step down or, move on. And I think a lot of people do that. I think, as I said, I deeply value patient care, but after you become, a trauma medical director, you're running a center, your ability to influence patients hands-on, one-on-one go away. But then you start thinking more abstractly about creating a system or a program or a culture that then reinforces what you value. And, that can be very, very powerful because then you sort of see your ideas expanded upon by others and carried forward. And I think that's really energizing. So you go through this sort of evolution as you mature and as life sort of has a way of unfolding. And I think, to use the surfing analogy, you sort of ride the crest.
Mhm.
You're both from California, so I'm an East Coaster. There's no surfing here. So
I was going to say
there's surfing there.
There's a current representation, at least, I guess there technically could be surfing in Staten Island, but Los Angeles and San Diego definitely have some surfing.
I was
I'm
just
3
in
hours
Maine and there's some
inland.
surfing, but people are wearing rubber suits, so I don't know about that.
Yeah.
Kind of
So-
look like a seal.
Well, that's only a problem if there's sharks around.
There are.
And there are, yeah. Well, and Laura, I'll jump in with a question because as Chuck, I mean, I agree with everything you were just saying. It's nice when you're a relatively senior person because you do have more control over what you can say yes or no to. As we're thinking about, I mean, we all vividly, some of us more vividly than others, maybe remember being young faculty, and part of the encouragement is to say yes to a lot of things. And I speaking from personal experience, have found myself in the situations where you've said yes to too many things. How do you say no without appearing to be uninterested? And I'll throw that to you, Chuck, and to Alex and Najiha and Laura as well. I mean, it's any advice for people who are listening. How do you say yes and then say no?
In a nutshell, carefully. So I think
Thank you for that, Dr. Adams.
I think coming out of the pandemic, I was reading in the business sort of world that the new sort of feather in your cap was saying no to your boss. And, if you were overburdened and overworked, it wasn't that your job was bad or your boss was unreasonable. It was sort of pointing the finger at you. You're unable to say no. And this, I found this very interesting because as a surgeon, I found that to be kind of foreign. We don't have that ability, right? And you do have the world's greatest excuse, right? It's like, sorry, I missed the meeting. I was in the OR, or sorry, I had to see a patient in the ICU who was not doing well. And you sort of have that ability, but again, not to sound like a broken record, I do think it comes down to your values. I can tell you, like, I wrote a lot of book chapters, and if you look at my CV, I'm always second or third author. But I can give you the secret. I wrote every one of those because what I did was I got the draft from my partner and then rewrote it into English. But since they did the grunt work, they're the first author, and rightly so. It reached a point in my career where I'm like, I am no longer going to do that. If you want to write this book chapter, it's all yours. But I am not going to be your secret editor. And, that was accepted because after a while, people are like, all right, you've done that, been there, done that. The problem is when you're junior, as you alluded to, is you cannot say no to certain things. And everybody wants to, I'm sorry.
No, please finish, but I want to push back a little bit on that.
Mhm.
Go ahead, push.
Well, so sorry. So, full disclosure for the people watching, we had a little meeting last week, and one of the things that I said to Dr. Farooji, who I don't know personally, was congratulations on finishing your hardest year of training, your first year of being an attending. Truly, truly, it is, despite every person who has a program director or an APD or a faculty mentor hat on, like, she or he wants to prepare you, but the reality is at some point you just have to be in the deep end, and you know how to swim and you have the swimming fundamentals, but you have to actually be in the deep end. I think without resorting to generational stereotype, I do think that modern general surgery academic practice is more okay with more junior people. You should say yes to almost everything, I think, in your first year within reason. Like, if you get an opportunity for sponsorship, you should really think long and hard about saying no to that.
Yeah.
But I think it is reasonable, without saying, yes, yes, no is a complete sentence. And if you do need to say no in your first or second year as a junior person, I think it's reasonable to say, this is such an amazing offer. I so appreciate you being a sponsor for me, TMD, division chief, senior partner. Can we work together on this? Or can I bring in someone else to help me with this? Or, I'm so flattered. Thank you for thinking of me. I let's put it on me, right? I want to be the program director when I grow up. This was, 5 years ago. And I said yes to being a medical director of the surgical step down, which, to be honest, at this point in my life, I like that job, but I probably do need to give that up, or at least think about transitioning some of that to some of my more junior partners, because now I don't identify as mid-career, but I think I'm getting, towards, I'm going to be up for associate maybe in the next year or two. Like, we did a little bit last week about headshots and how truthful they are. But I think even in your first year, because we know it's such a hard year, I do think it's reasonable to say, I really want to, I want to be a good team player. I want to be a good partner. And how do we work together? Like, I love this opportunity. I want to run with it. And maybe it's an opportunity for two people, or maybe it's an opportunity for, a very senior partner who's not in leadership anymore to be sort of an emeritus sponsor, mentor for another ask. I just think that, like, I think to some degree, the conventional wisdom for a long time has been say yes to everything. And I think what that leads to is exactly what you talked about in your talk about, you got to make sure that it does resonate with your compass. The other thing that's lurking, I don't recognize nearly as many names as the people in SCCPDS leadership on this call who are among our folks who are watching this live, but I imagine a lot of you are fellows, and I think it's okay to not know which way your compass is pointing, or like maybe you have two compasses, or maybe this is a silly extended metaphor, but like maybe your new Apple Watch compass and your old compass, and you're trying to reconcile. I think it's okay to say, like, I think I want to be a program director, but I'm not sure. Or, we were teasing Dr. Haynes that she manifested everything into the universe that then she inverse got of, like, I'm never going to be a division chief, and lo and behold. Anyways, long answer, but I just think I just want to push back a little bit, because I think the first few years are so crucial to sort of be on that path of discovery that you talked about, that idea of like making a moral inventory. And I think it's okay to, like, you don't want to be rude and you don't want to not accept sponsorship, but I think it's okay to sort of negotiate for what you need a little bit.
I 100% agree with that. So it's interesting what you're saying. I've just like lived it, and I'm like, yesterday only I did this. I did the same exact technique with one of my senior partners. The hardest person to convince to say no, at least for me, was myself. I am a people pleaser. I was a people pleaser, and I could not just, for my female ego was there, and I was like, no, I have to do this, and I will do it, and everything will be done. And everything got done, but the person who suffered the most was me. I didn't have a personal life. I didn't really know how to, come back home and, like do something else. I was just doing my work thing. As time went by, my internal compass I think, kind of aligned. And then I convinced myself that it's okay to say no, and I'm not going to die, and no one else will die, and it will be okay. And subsequently, life became better, because then my mental, bandwidth was freed up to do things that I really want to do, and help me feel more fulfilled with work, no matter how difficult the circumstances were. But the most difficult person to say no in the beginning was myself.
Yeah, I think saying no is always very challenging. And I think, like you said, Dr. Adams, you have to do it very carefully. And so I think honestly, I think what Alex was saying was that very carefully part. What both of you were saying was that very
100%.
carefully piece. And so I think that's important. And it all comes back to your why and understanding your why. And sometimes you say, Like you said, I'm never going to be a division D. But that's because I didn't understand what that actually meant and how that actually aligned with my why, and what that actually, how that aligned with my inner goals and the things that truly give me energy. Because there are many things that give me great energy, and you guys all described many of those things. And there's many things that take it away. And the take it away, I don't include the things we have to do our job, like Epic, notes, that's just part of doing business, right? Some of that's just the cost of doing business. But knowing those other things that take your energy, that it's not about avoiding it, it's about understanding it so that you can manage it. So some of you may be shocked to hear this. Large groups take my energy. If I'm in a group of lots and lots of people, parties, banquets, that sort of thing, I'm exhausted the next day. Exhausted. And it's not that I don't like talking to people and I don't love interacting, but it's something that honestly takes my energy. And I know that because I know what I have to do the next day, or because I'll go home and I won't call my parents. I won't talk to anybody for like a weekend if I have a big event. And so, but understanding that about yourself and understanding those little things that you're like, I did have to recover from that, or interesting. Those are the little things that understanding those pieces about yourself help you kind of compensate. And it's that resiliency and that understanding about yourself that's kind of that builds that in yourself. So understanding your why, understanding your energy, and kind of how that goes into your leadership and your interactions every single day. Because we all have, like you said, we've got compasses on both watches. We got our phone here, we got the old school compass sitting on our other, but really how those align really comes down to our inner why and our acceptance of those little pieces. So asking the question for me is really an understanding of oneself, not so much it's a positive or a negative. Does that make sense?
So Alex sort of said he was going to push back, and it's interesting because I actually agree with just about everything he said.
Yeah.
But something he said and something you said are kind of on the same page, and I think it's worth discussing. It's early on, you say yes to a lot of things because I think it's a discovery as well.
Mm-hmm.
What you were just talking about, like where you said, I would never do that, and then you wind up doing that, that means that your premise that you would never do that was wrong because you're doing it. And why was that premise wrong? Because it was a misconception. So once you sort of say yes to some of these things, then you get the experience. You're like, oh, actually, you know what? This is kind of good. I like this. This jives with what I want to do. So I do think there's a real value early on as you discover yourself, what you are, who you are, where you're going, to do those things. So saying yes and spreading yourself thin early on makes a lot of sense. I just know that as I get older, I'd probably die if I tried to do what I did when I was younger. Reality has a way of, opening your eyes. So
part of my passion about like leaping on you, and I think for context for the people who are watching this, like we've never met in person, so it's not like I'm not meaning to overstep or be too crazy, but I feel really passionately about this idea of making sure that you have to be uncomfortable. Pardon me, you have to be comfortable being uncomfortable. And I'm someone who was a job changer. So I took a first job out of fellowship because I thought what I need to do is be at this place, which is going to be awesome. And it's near where I grew up. And I think it's going to be great. And they're telling me all these great things. And then I show up, again, global pandemic, a lot was happening. It turns out that like COVID will make you like live with a 5-week-old and a 5-year-old in your childhood home in New York. And, that was a voyage of discovery. A fearless moral inventory was made. But I think one of the things that I feel strongly about is I'm worried a little bit about in academic surgery that we're seeing a lot of turnover after 2 or 3 years at job X. And I mean, this is my own lived experience, but I actually happen to know a lot of folks who fall into this bucket of, I finished my fellowship, I took my first job, I learned a lot about myself, I got uncomfortable, I did things that I didn't think I would do, and they were great or they were awful. I learned about myself, and I'm worried that because we see, I think, a fair amount of turnover. I don't think that anyone has studied this in a rigorous way, but I feel like a lot of people throw around this idea of in your first 3 years of academic faculty, about like 50%, 40% of people, there's turnover. And that's really disruptive, particularly for our house in the house of surgery, I think. I mean, that's probably also true if you're a surgical oncologist or a breast oncologist, but I'm not that. But I'll tell you that like anyways, Christy, you should go out. But I just
No, I was
that's
gonna.
part of my passion about. We got to take care of our youth. Like
Yep.
like Dr. Farooji, I'm your first year, which is great. I want you to protect your peace and like, Staten Island, I want them to take care of you and I want you to take care of them. And I want to send you good Reiki, to Shaolin out there and be okay.
So I'll push back just a little bit because that phenomenon has been going on. I was one of the people who was at one place, for a few years and moved on. And that is a phenomenon that has been going on. That is not a new phenomenon. And I think that may be part of the discovery process. Who you thought you were, you get to a place and you say, you know what, this isn't the place for me. And I'm not sure it is disruptive, you're right, but it also gives you perspective on other things and maybe an awareness. So it's not necessarily a bad, again, yes, disruptive. And yeah, 5-year-old, 5-month-old living in your childhood home, that must have been eye-opening.
Yeah.
But this is not something newly related. We do have a question and answer. I'm trying to watch the clock too, because I think the 5 of us could keep on chatting all afternoon. So I'll read out the question. As a fellow entering the job market, someone who's still trying to figure out themselves, doesn't have a 5 or 10-year goal, what's some advice on figuring out your best first job and what to say when people ask you? Because there are people like that who have a 5 and 10-year plan. How do we answer that?
That's a great question.
It's an excellent question.
I mean, I disclosed that I'm on my second academic job in 5.5 years. So I think for me personally, I learned a lot. And Krista, I agree with you 100%. I think the ideal attrition in surgical residency is not 0%. The ideal reintubation rate in our surgical ICU is not 0%. I just worry that, I want to make sure that we're keeping care of each other. I think for your first job search, it's really important to not fall in love with the first person who asks you to prom, to get your collateral, to find the people in your division or your department or your hospital who have been there a long time and try to figure out like what sustains them. And then are they going to help you? Because hopefully everyone who hires a junior partner who gets a terrible gunshot wound to the iliac vein is coming in to help them if they're on backup. I hope. But it's more so about, are there people around either in the trauma division or in the Department of Surgery or in the hospital who you look at and you say, it was so lovely to interview for this job with, the CMO or the director of outpatient operations, and they're so groovy. They're thinking critically about how to make things better. And then you really have to like take a beat. So one of the mistakes that I made was I got a job offer very quickly after an interview. And I said, you want to pay me how much money to be a doctor? This is amazing. And in retrospect, it was a lovely thing, but perhaps I should have taken a little bit more time to consider whether this was actually the best place for me. And I don't want to like read into, I don't think it was nefarious that they were trying to get an offer to me quickly, but I would say that you want to figure out, why are they hiring? Are they expanding? Are people leaving? Leaving's okay. Are people leaving on good terms? What's going on? And just also know that like, I agree with Dr. Kalps, like some degree of change is going to be inevitable. And so it might be the case that you do all of your diligence and you get all the collateral and you find your mentors and you still end up in a place that's not the right place for you. But it's really tricky. And I think it really relies on mentorship. The people who know you in fellowship, the people who know you from your residency. And then also, Dr. Adams, you were talking about this idea of like your trusted advisor, which might be your partner or your spouse or your family or whatever, really kind of making sure that you're doing some reality testing. That's my 90
Yeah.
seconds.
Naja, we'll throw the question to you. How do you
So I
figure
have
out?
to agree.
Yes.
Okay. I do think that that a person knows whether they want to be in academics or whether they want to be in RVU, private-based practice. So that's something that will help you, categorize and, kind of like filter out a lot of things. But the most important thing is not about yourself. If you don't know, if you don't have a 5-10 year plan, that's fine. The most important thing is the place that you go to, what kind of environment is there? Find out about, because what if after the contract is signed and you go there, you can't change anything, right? So find out about these people, find out about who they are, what they're going to do, and if they're really saying the truth to you or not. A very senior attending, I was just discussing the same question with them 2 years ago at a conference, and I was like, what would I do if they did not really deliver what they promised before? And I got a scolding saying that you should not be focusing on that, you should be focusing on your training and this and that. And I wish I had not listened to them, because you kind of you need to have these tools to survive, and then once you learn survival, then only you can thrive in these kind of environments or situations where you might not get, or you will never get what you were promised for, and nothing, whatever is on the paper is also ambiguous.
Yeah, I mean, I think one thing to say though is like do-overs are allowed. You might at the end of your fellowship say, I want to be the busiest clinical surgeon. I want to work at the level 2 in this city. I want to bill 25,000 RVUs my first year. And then 3 years in say, hey, actually what I want to do is clinical research and work with fellows. And that's maybe a topic for another webinar about making that transition between those two career paths. But, I can think of a number of people among my faculty who were more in sort of a private practice setting for a year or 2 or 3, and who said, hey, I really miss working with trainees, working with students, and did a career change. You're right, though, Dr. Farooji, if it's not written down, then the skeptic would say it's never going to happen. So you can be promised the moon, but unless it's in black and white ink that gets signed and notarized, talk is cheap. But I think at the end of the day, also, I don't want to sound like overly negative or like have this poor person who asked this question be paranoid from our answers. Like, I actually think the House of Surgery is full of wonderful, kind people and who really do want to help people and recruit good partners and have a good match in a job and support your success. And I think you just need to sort of, it's okay to be a little bit selfish, like you're free of timelines, maybe for the first time in your life, where you don't, other than those annoying things like rent and health insurance, like there's nothing that says that you need to start your job after fellowship on September 1 or October 1. And so, like talk to people and put yourself out there. Dr. Adams was talking about like, I really like public speaking. I'm an extrovert. So like, unlike Dr. Haynes, like I get energized by big groups of people, but put yourself out there. You're allowed to be vulnerable. And as for the 5 or 10 year plan question, I think it's okay to be honest, to say something like, the thing I've really loved in fellowship and residency is clinical research. I think that's what I want to do, but I'm really open to learning more about, I'm interviewing with you for a job and you're talking about that you're looking to expand clinical operations, or you're looking to expand your education program, and being open to sort of trying on some different hats early on.
If I may, we've talked a lot about the first part of the question. If I may just briefly address the second part of the question, which is, what do you say when people ask for your 5 and 10 year plan? I think the first thing is be honest. If you don't know for sure, that's okay. But you can also say, I don't know for sure. I think there's a possibility I might want to be a trauma medical director because I really enjoy PI and I really enjoy trauma systems. And I would really look forward to the opportunity to learn more about that and to even participate as an associate or assistant TMD, if that's something in your interest, or an APD or whatever. And I think understanding those pieces about yourself, and while you're in fellowship, this is your exploration time, right? So you should be getting exposure to these areas in your own division that you're now interacting with, and starting to sort of think about the things that you're seeing around you as okay, opportunities. I enjoyed this. Oh, I got to do this. Oh, that really was fun. Those are the things that you should start thinking about and helping to identify in yourself. And that's that internal compass, right? That's where it all comes from. This is what I know. This is my why. I enjoy X, Y, or Z. Because we're all going to do the same things. We're all going to teach residents. If we're in an academic center, we're all going to work with them on a daily basis. We're all, or on clinical service, we're all going to do X, Y, and Z. But it's those other little extra things that are part of what we do within the profession that then you can start to develop. And so it's okay to not know exactly what you want to do, but you should be able to articulate what you do enjoy and the parts that you want to contribute to, because that's what we want, right? When we're looking for people to join our faculty, we want people who want to contribute. Simulation center, education, PI, whatever it is, medical student, X, Y, or Z. There's a million different jobs and things that people can do.
So just to follow up on that, I think it's a very useful exercise to come up with a 5 and 10-year plan. Essentially what you're doing is articulating a goal. But what I also think you need to do, and to sort of go back to the whole concept of this talk, is answer why. Why did you answer the way you did? Because that is essentially defining your compass. And that's why it's such a useful exercise, is to sort of come up with a 5 and 10, 20-year plan. Because it's just a back door to sort of saying, here's what I want to do, here's who I am, here's what I like, here's what I don't like. So I think there's real value to that. Having said that, the vast majority of those plans never come to fruition. Mine got totally nuked and blown up, and that's okay, because ultimately I turned out okay and I got to where I wanted to be just through different means. So don't be too upset if you don't have a highly articulated step-by-step 5, 10, 20-year plan. It's very important to try and do that, but don't let it become a trap. And just understand that no matter how much you think, you really want to do these things, you're probably going to change radically in 5 or 10 years. Who you are now will probably bear very little semblance to who you are in 10, 20 years. We all sort of change.
And that's totally okay.
That's okay. In fact, yeah, that's the norm.
That's actually good. We should change.
Yes.
And I think, the other small piece I will give, as you're developing your why and you're asking these questions, people often in the interview process for fellowship ask me, well, what's your mentorship pattern? And my answer to everybody is always, we all have a board of mentors, whether you know it or not. You have a mentor who you go through for personal things, professional things, research things, systematic things. Know your board of mentors, and developing those people who you can reach out to for different reasons is really important, because they're also the people that can throw things back at you and sit you down and be like, dude, you gotta talk. And those are the most valuable people in your life, so embrace them.
Yep.
Awesome.
All right. Well, we're over time. I didn't mean to take the last word there of any sort. Any final words
You get to.
for the group? Thank you all so much for joining us today. It's been an absolute pleasure to interact with you all. I'm so sorry Linda couldn't make it. She did have a family emergency and is so sorry she couldn't be here, but we really value everybody, and we look forward to the next webinar for SCCPDS and for our fellows. So we are all here. You have our contact information. If there's anything we can do for anybody here, let us know. And if anybody has questions, our email addresses are available. So thank you all so much.